Welcome to another edition of Disability and You. I'm Ganesh Singh and I'll be with you for approximately 30 minutes. On this edition, my focus will be on cancer. Recently, we observed World Cancer Day, and it's a day designated to raise awareness on cancer, the consequences of persons or who are living with cancer, the effects of it, and so on. With me to discuss this topic, but more from a men's perspective, a men's health perspective, is Dr. Raj Sukhraj, who is a consultant urologist, and he's going to tell us all about men's health as it relates to prostate cancer and so on. Dr. Sukhraj, welcome to Disability and You.
All right. Thank you. Thank you very much for having me. And so as you rightly said, prostate cancer is one of the common conditions that we see. In fact, prostate cancer is the leading cancer among men. It's the number one cancer in men, and it is the leading cause of cancer-related death in men, and that is in Guyana as well as in the rest of the Caribbean. So it is very common.
So that's a very interesting statistic. Why? Why do you think we have such a high rate of prostate cancer within the Caribbean and in Guyana?
So some of it probably has to do with genetics. Some of it is probably lifestyle. We're not always sure as to why the cause is there, but it is a reported fact that we do have some of the highest death rates from prostate cancer than people living in other parts of the world, as well as some of the highest incidence of prostate cancer. In fact, in Guyana, and the minister just reported some statistics from last year, we diagnosed 136 men with prostate cancer.
Wow.
Right. And it is the number one cause of cancer in Guyanese men. That is our local statistics. That is not just quoting from overseas.
All right. Let's start now with how can someone prevent prostate cancer? What are some of the preventative measures? And this starts from very young. So tell us, what are some of the precautions, and how often can someone should take a prostate exam?
All right. So just if I can back up a little bit and just tell you about the prostate itself. The prostate gland is a part of the male reproductive organ. Right, it is supposed to be there. Every boy child is born with a prostate gland, and as you develop into a teenager, and then an adult, the prostate gland gets bigger. And then there are generally two conditions that can affect the prostate gland. Right, there are more, but the two common ones are enlarged prostate, which I'm sure you've heard about, and most of your viewers would have heard about, and then there's prostate cancer. All right, so those are the two common conditions that we encounter in clinical practice. Now, prostate cancer, one of the problems with it is that it doesn't actually have much symptoms in the early stages, right, because of where it occurs in the prostate. Now, the prostate sits just below the bladder, and in fact, the urine from the bladder to the outside passes through the urethra, which is a little tube that brings urine out, and that tube passes straight through the middle of the prostate.
Prostate, yes.
Right? Now, enlargement occurs just around where that urethra passes. So very early on, when you have enlarged prostate, it starts to squeeze on the urinary channel, so you have issues with the flow of urine. You have to push a little bit harder. Sometimes it will start and stop. Now, the prostate cancer occurs in the same organ, but in a different part. It occurs on the outer part of the prostate itself, right? So if you think of it as an apple with a straw through the middle, the cancer occurs in that skin of the apple on the outside of the prostate. So early on, in the early stages of cancer, there is really no symptom because it doesn't interfere with urinary flow. Okay?
Interesting.
Only when it becomes advanced that it can actually show up with symptoms. That is when it starts to spread, or it goes to different parts of the body. It metastasizes. It goes to the spine and other parts of the body that you can actually start having problems. Now,
go ahead.
Sorry. So you asked me about prevention. There is not much that can be done in terms of prevention. There is a big genetic component to this. Right, so every man is at risk of developing prostate cancer, especially as he gets older. I mean, those are not things that we can avoid. There is a genetic component, so a family history of prostate cancer, particularly men of African ancestry, have a higher risk. Again, that is not something that you can change if that is your reality. But there are a couple of conditions, including obesity, smoking, right? And certain anything that can affect your immune system. Those are things that we know will put you at risk of developing cancer in general, not just prostate cancer.
Yeah.
Now, you see, your body has an inbuilt mechanism of recognizing cells that are abnormal. Cells in your body are always replacing themselves and dividing every day. So when you have millions of cells dividing, you will have errors in those cells. You will have abnormal cells forming. But your body has an inbuilt mechanism, the immune system, which will recognize something as being abnormal and destroy it. So if you do anything to your body, or if you have any condition that affects your immune system, that suppresses your immune system, you're more prone to cancer. And that is where things like obesity and smoking and certain infections such as HIV will come in. So because those suppress your immune system. Certain drugs, people who have had kidney transplants or any other form of transplant, and they're on immunosuppressive types of drugs, right? Steroid use. Those things suppress your immune system. So when you ask about prevention, those are probably
Those
the
are
things.
just some of the ways.
Yeah, those are some of the things. So do not avoid smoking, exercise on a regular basis, eat a healthy diet. But I'm not saying that if you do all of this, you will not get cancer. You're still at risk. Once you're a man, especially a man of African ancestry, you're still at risk of developing
And if
cancer.
you have it in your family history,
Yes, I mean those are not
genetics
things.
will play a factor. Yes.
Absolutely, you can't change certain facts.
And persons who are predisposed to this based on the genetics, and also ones that are not too healthy and have been at smoking all their lives, or consuming alcohol, not maintaining a healthy lifestyle, when should they take a test, or how often should they go get an examination done?
Right. So, prostate cancer is the most common cancer in men, even if you have no risk factor or no known risk factor apart from being an older man. All right. So, the current guidelines, and we have adopted these locally as well, recommend that every man between the ages of 45 and 70 should get a PSA blood test done once per year. That's a prostate specific antigen, right? So every man above the age of 45 until he gets to 70, we recommend every year getting a blood test done, a PSA blood test. If you have a family history, or if you're of African ancestry, meaning you're now at a higher risk than the rest of the population, we actually recommend starting at the age of 40. Right, and this is the local guidelines. This is the Guyana Ministry of Health guidelines, as well as it is the National Comprehensive Cancer Network guidelines, which is an international guideline that most people will follow. So we comply with that as well.
All right, Dr. Sukhraj, let's go back to what you said earlier, and I must admit that I confused the two with prostate, a swollen prostate or an enlarged prostate, and cancer. Can an enlarged prostate lead to prostate cancer?
No, so simple answer is no. So the enlarged prostate, or BPH, which is benign prostatic hyperplasia, it's a totally different disease condition. Simply occurs in the same, older man, in the same organ, a different part of the organ. Whereas prostate cancer occurs on the outside, BPH will occur usually more in the center of the prostate. But no, they're totally different. One does not become the other. So an enlarged prostate does not become cancer. And there are men with big prostates who have cancer. There are men with perfectly normal sized prostate who have cancer. So they're not related in any way apart from the fact that they both occur in older men.
So thank you very much for that clarification, because honestly, when you explained the straw in the apple scenario, I got a better understanding of the prostate and how it works and where the cancer is. You mentioned the rogue cells and the body ability to, once you have a strong immune system, to fight off those rogue cells. You mentioned not smoking and so on, but what are some of the other things that someone can do to build their immune system?
So a healthy lifestyle, right? And this goes not just about cancer, but everything in general, diabetes and hypertension, and avoiding chronic disease. A normal, healthy lifestyle. So eating a balanced diet, exercising on a regular basis, at least 30 minutes of cardiovascular exercises, at least 5 times per week, right? Avoid abusing drugs. I mean, yes, we all have our bad habits, but the abuse is the problem. And I'm not saying, a glass of wine or a drink or two is going to cause you to have anything major, but the abuse, that is where we don't seem to understand moderation sometimes, right? So, and a balanced diet, lots of fresh fruits and vegetables, and, a variety of food, not just fast food and, those sorts of things.
And the processed foods definitely is a no-no to the most part.
So as best as possible, I mean, you have to eat something, all right? So there are
That's true.
times that you cannot avoid it. I mean, everybody's circumstance is different, but as best as possible, I mean, there are lots of chemicals and preservatives and so on, and we know that there is a correlation between some of the preservatives in foods and cancers, different types of cancers. Not specifically prostate, but we know that, certain types of foods can predispose you to certain cancers.
All right. I know many persons are, have the wrong idea about a prostate exam, and you mentioned a simple blood test
Yes.
can tell you if, there's certain risk, you're at risk or you have certain signs there. But what about the invasive prostate exam? And I know a lot of men, speak negatively about this, not wanting a device to be inserted and so forth. Could you explain that a bit more for us so that we can have a better understanding on that invasive prostate exam?
All right. So in terms of screening for prostate cancer, all right. So screening is where we test for a disease in a patient who has no symptoms. So we invite every man, as we mentioned, those ages 45 and above, to come and get tested. And what we're recommending right now is a blood test. It's a simple blood test. In fact, some of the modern machines that we're using now is just a little finger stick, like you're testing your blood sugar. All right. So we do not really recommend. It is still optional. The digital rectal exam, or a finger examination where a doctor places a finger in the rectum to feel the prostate. It is not a routine part of screening. This is a man who has no symptom. He's just coming for a checkup to make sure that there is no early sign of prostate cancer. All we're recommending right now is a simple blood test. If the man has symptoms, or if the blood test result is high, well, then we need to go on to do further testing and further examination. And that is where we will probably do the examination to see if we could feel any lumps on the prostate and so on. But in terms of screening, we do not generally do that examination. We've moved away. We recognize that it is one of the things that has been keeping men away, all right, because of the stigma, because of the macho culture, and men
Definitely.
have a negative connotation about it. We do not really aggressively push that, and just the blood test is good enough, right? But if we find something on the blood test and we need to do further testing, well, then yes, it is important that we do that examination. That is when we start talking about stage of disease. We have to look for lumps, see if there's any evidence of spread and so on. But generally, we've moved away from that. So there's nothing to be ashamed of. It's a simple blood test. It's as simple as getting your blood sugar done. It's just a simple finger stick in many cases.
I'm glad for that clarity, and I'm sure a lot of persons that might be listening to us are, much more at ease now, knowing that they can go and screen for prostate cancer without having an invasive procedure done. Dr. Sukhraj will pause for a short break. On the other side, we'll discuss what are some of the treatment available for persons who have prostate cancer. Dr. Sukhraj, before we went to that short break, you were discussing, persons getting screened and so forth, and you mentioned the PSA test. That's the simple blood test being done with just a simple prick of the finger, like you test your glucose level. If there's a high, or the symptoms are there, or the signs, sorry, and that blood test come back negative, what is the next step?
Right. So if you've done your PSA test, the blood test, and it's normal, within normal range, we ask you to come and check again in a year. If the test is high, then your physician or your practitioner who is doing this test for you will generally refer you now to a urologist. Right. That's where we come in. Right. The screening part can be done by a primary care doctor or medics or anybody. You don't need to see a urologist to get screened. If they detect something abnormal, so what the PSA tells you, the PSA is a chemical that is produced by the prostate gland. Every man has a prostate gland, and it produces some amount of this PSA chemical that is released into, some of it is absorbed into the bloodstream. A lot of it actually comes out when the man ejaculates, right? So So we all have trace amounts of PSA in our bloodstream. When that level goes very high, it tells us that there's something wrong with the prostate, but it doesn't tell us what. It doesn't. A high PSA does not necessarily mean you have cancer. There are other causes of high PSA, including an enlarged prostate, including infection in the prostate, any kind of injury to the prostate, right? So if you've had any type of procedure done recently, it can cause your PSA level to go up. So which is why you need to see a urologist to put things into perspective, right? If we cannot find another cause for your high PSA and we suspect that it might be cancer, now there's only one way to confirm cancer, right? We need to take a little sample of that prostate, send it to the lab. The pathologist will look at it under the microscope and tell us whether they're seeing cancer cells there, right? That's called a biopsy. So the next step, if you have a confirmed high PSA level and we suspect that you have cancer, then we will do a biopsy. Generally, biopsy is done ultrasound guided with local anesthesia. You don't need to go on, you don't need to go to sleep for that. It's done as an office procedure most times. You come in, you get a biopsy done, you go home. Within a week or two, you get a call to say your results are ready. Come in and let's have a discussion. All right. If it comes back that yes, you have cancer indeed, well then we need to talk about the next step as to what do we do next.
And what are those next steps?
Right. So once we've confirmed the diagnosis that yes, we're dealing with prostate cancer, generally the next step is to figure out the stage. Right? Stage means where is the cancer? Is it in the prostate alone or has it gone outside? That is essentially what we need to establish. And if it's so, we would usually do a CT scan or an MRI scan, and then there are certain special bone scans that we will do to check to see where the cancer is. Is there any evidence of spread outside of the prostate? If the cancer is in the prostate alone, we have the opportunity of cure, right? So there are two main forms of treatment that we offer for patients who have what we call localized prostate cancer, which is cancer within the prostate gland itself. Two main options that we have are radiation and surgery. All right, surgery is where we remove the entire prostate gland, and then with cancer and everything in it, and then we have to kind of put the bladder and the urethra back together. It's a major operation, but at the end of the day, the intention is to cure you of cancer. Right? It's a very good operation. We offer that locally, and it is curative. The intention is to be curative. The other option is radiation. Radiation is where you actually use, something like very, very strong X-rays to actually burn the prostate. Right? Again, the intention here is to be curative. Right? So those are the two main options, and that is also locally available. Right? So those are the two main options for localized prostate cancer.
And if it's further along?
Right. So if you have what we call metastatic cancer, cancer which has spread already at the time of diagnosis, now we don't have the ability to cure that. What we can do, however, is that we can suppress it. Right? We can give you medication which will slow the cancer down, and it will actually prolong your life and ease some of the symptoms that you're having. Patients with metastatic cancer often have a lot of back pain because the cancer that's the first place prostate cancer spreads to your backbone, the spine. Right? If left alone and you don't treat it, you end up with what we call fractures in the spine. You can end up paralyzed from waist down. Right? A lot of men, unfortunately, almost half of the men in Guyana are actually coming at the time of diagnosis with stage 4 cancer, with stage 4 prostate cancer, cancer which has already spread. We don't have the option of curing that at that point in time, right?
Yeah. Dr. Sukhraj, and you mentioned the first two if it's localized, and that is taking out the prostate or a radiation. And I'm sure a lot of men who are, they see their sex life as a big part of their everyday living. An adult man. How does it affect the reproductive organs, so to speak, once you are in treatment?
Right. So the treatment is going to affect in two ways. When a man ejaculates, if he's able to have sex afterwards, he's not going to see anything shooting out. He's not going to see anything coming out, because the majority of that fluid that comes out is actually from the prostate itself. Right? The other thing, some of the treatments that we offer do cause some problems with sexual function. Right? We know that. But the priority and at the time of being diagnosed with cancer is actually to cure the cancer. Function we can fix afterwards. Right? There is treatment. Yes, we know that the operation, the surgery will cause some erectile dysfunction. We know that radiation can cause erectile dysfunction because the nerves that control erection run right outside the prostate. So at the time of surgery, at the time of radiation, sometimes they
It
get
would be
stretched.
affected, yeah.
Yes, they get stretched, they get injured. Sometimes we end up having to cut them. If the cancer has spread into them, we have to remove it. Right? But there are options that we have afterwards to fix that. We can give you, back your sexual function once we have cured the cancer. So the priority at the time of making a diagnosis, and this goes for any cancer, curing cancer, we deal with function and form later on.
But the priority is getting rid of the cancer as
Yeah,
much as possible.
absolutely, absolutely. And radiation and surgery are intended to cure.
Dr. Sukhraj, what about raising awareness in Guyana? I know through the Men's Health Unit, Ministry of Health, and so on, they've been doing some work on raising awareness on prostate health and general men's health. But specifically as it relates to prostate cancer and so forth, what are some of the things that you and other persons in your profession are doing to raise awareness on this?
Right. So I am happy to say that there's been a lot of work that has gone into this, and the Men's Health Unit, the Ministry of Health, through the Men's Health Unit, Dr. Sawan and his team, they have been doing a wonderful job. In fact, in November of last year, we launched a national prostate health strategy. So we didn't call it prostate cancer, it's prostate health, because we're looking at the enlarged prostate cancer,
yes.
erection problems, things that affect a man in general. A man is not just his prostate. We have to look at the holistic approach to medicine. So we've launched that. In fact, the minister recently reported on some statistics. Last year alone, we did 15,000 PSA tests, meaning 15,000 men in this country were tested for prostate cancer.
And that was in the public health system,
Public
or
and
it included private?
Public and private. So there's a lot of work that's been going from the Ministry of Health point of view. The private facilities have been doing their part in many times doing, subsidized testing or PSA testing and oftentimes free PSA testing as well as non-governmental organizations such as the Guyana Cancer Society. Through that, we've done more than 1,000 free PSA tests for men, and we've touched just about every region in this country. Right? It's not something that is just focused on Georgetown or the major centers. We've gone to every single region, and especially through the Men's Health Unit, we've sensitized, not just the healthcare providers first of all, because they had to be, in some cases retrained that, this is something that we need to focus on as well. We've started doing prostate biopsies and PSA testing in places that they were never done before. Right, Letem, Bartica, Madia, these are places that we've actually gone to and done testing.
And that's highly commendable, getting it into the hinterland and rural parts of Guyana.
Yeah, in fact, we've probably done more work in the hinterland than we've done on the coast, which, is something that we also need to be conscious of.
And it's pleasing to know that a lot of work is being done in this area, because generally we do not take our health seriously in Guyana, and, we look at taking precautions or going and get various tests done at general medical and so forth. And to know that, this is not something that people pay a lot of attention to anyways. To know that so many tests were done last year, that's highly commendable, the work that you guys are doing. Persons with disabilities, especially those who use wheelchairs and probably have physical disabilities, is there any relation, or do they, or can we say that they're at a higher risk or whatever it might be because of some spinal cord injury or something to do with their disability? Is there any correlation that you know of?
So prostate cancer specifically, I cannot say. I'm not aware of any relationship. I know bladder problems you can have because of you're not able to control the bladder and empty the bladder, and a lot of people.
And there's no relation with that to the prostate.
No. But bladder cancer, probably there would be an increased risk because oftentimes people have catheters or they use catheters, so that increases the risk after a period of about 10 years. But no, prostate cancer specifically, I'm not aware. What you may have happening is access to care might be a bit of a challenge to get. So getting tested early, if you have symptoms, accessing care, making an early diagnosis may be a problem. But that is more about access to care rather than the physical disability itself, causing a problem.
And that is why I wanted to clarify, because some persons with disabilities might feel that because of the position that they're in, they might be at high risk. Dr. Sukhraj, is there anything else that you would like to share as it relates to prostate health and men's health in general before we conclude this edition of Disability in You?
Right. So I just want to encourage the men out there, to go and get tested. Prostate cancer, it is the number one cause of cancer related. It is the most common cancer in men. The testing is available. I mean, we have done a lot of work to try to push this agenda along. We've made the testing available. And if a simple blood test, a little stick on the finger, can actually save your life, I mean, you really don't have a very good reason for not doing it.
Precisely.
Right? We can make the testing available to you. We cannot get tested for you. I mean, it is up to the men to actually play their part as well. So as healthcare professionals and as the people behind, driving this agenda, we have done our part, and we're not done by any means. We're continuing to do our part, but we also need the men to actually come forward and get tested.
And let's just remind them that it's not an invasive procedure. The screening is just a simple blood test.
Absolutely.
Dr. Sukhraj, thank you very much for sharing with us, and I'm sure that members out there of the public, they're much more aware, and some of the myths are actually busted as it relates to getting your test done and being screened. So I want to thank you very much and for the work that you're doing to raise awareness on prostate health.
All right. Thank you for the opportunity, and thank you for giving us this forum to raise awareness on this disease.
Excellent. And that was another edition of Disability in You. I want to thank you very much for joining me. Remember, you can join me on the National Communications Network for another edition of Disability and You. Remember, disability rights are human rights. Goodbye.